We'll go ahead and start with invocation and pledge of allegiance. Ramsey, if you'd lead us.
Father, thank you for the opportunity to serve our community. Give us wisdom and clarity in our decisions tonight. Help us act with integrity and in the best interest of our citizens. Protect our community and those who serve in it. In Jesus' name we pray. Amen.
Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, we'll move on from there. Number 4, announcements. Council, do y'all have any announcements?
I have one. Do you have one too? Here you go. I just have one. It's not really an announcement. It's a recognition. We've done some stuff at the park, and I wanted to recognize Paul Thompson, obviously a police officer, and Kevin Jennings. Both have gone over and above to get the cameras and stuff installed. Doing a great job. So
Nice.
keeping the doors locked on the bathrooms, keeping things up to date, keeping everybody informed of what's going on. But Kevin Jennings and Paul Thompson doing a great job.
Anything else? Just real quick, the city building will be under construction this weekend, getting prepared for it the next few days. Some of our personnel, like our secretary, she's not going to be the easiest one to get to some things, so I just ask everybody to bear with us. Should be hopefully with everything done late next week. All right, we'll move on from there. Number 6, administrator recruitment progress. Citizens, I'm so sorry, guys. Citizens input, I guess, because I didn't have any.
You do not have any for this period. Skip on that.
Sorry, guys. Yeah. All right, so now we'll move on to number 6, city administrator recruitment progress. Y'all know where we're at on getting the contract for the new city administrator. We're working on that. Latest update.
We should have the revised contract tomorrow. But he's just told this afternoon.
So it'll be revised to send back to him, or it'll be
Yes.
okay.
Yeah, I spoke with him earlier. He understands that we're trying to get it. Of course, it's probably going to push our 3/9 date.
That's my next question.
But depending on how much he has to say to push back, and which we know that when we talked to him, he had a previous thing that he wanted to do around the 14th or 15th of March. I don't remember which, so it might be easiest depending on this, but getting him started as quick as possible is a top priority. Anything else on the administrator?
I don't have anything else.
Okay. Number 7, discussion and or action on presentation from Texas Health Benefits regarding staff benefits. Hi.
Hello, I'm Lori Crane with Texas Health Benefits School.
Is her mic on?
Yes, her mic is on.
Okay.
Sorry. I'm your account executive with Texas Health Benefits School.
Can you please talk a little louder?
Okay. Let me get this up. Okay, so I am Lorraine Crane, Texas Health Benefits School. I'm your account manager, or account executive. And we just wanted to take this opportunity to present to you some renewed numbers for your account. And I very much appreciate you allowing me to come and present to you today. So the city has been with the pool for over 23 years, and we thoroughly appreciate that. We've enjoyed each and every year, and we surely hope to continue on with that relationship. So I want to just kind of remind you of the power of the pool. Texas Health Benefits is a nonprofit risk pool governed by a board of trustees who are locally elected officials, such as yourself, and they're from all over Texas. They bring together 600 local government entities that helps drive our costs down for our members. and it leverages the purchasing power. You're not just 14 or 17 lives, you are a part of a 23,000 member group. And with that, we are able to negotiate all types of contracts on your behalf and bring you the best value we can. As a self-funded risk pool, we stabilize rates for the long term and pass on that savings to our members. As a member of the risk pool, you experience all the advantages of a self-funded plan without the risk. As a member of the pool, our interlocal agreement automatically satisfies the Texas competitive bidding rules. So without having that agreement in place, you would have to go out bid formally every 3 years, but we do that for you. We are exclusive to Texas local governments, so we understand your challenges better than most. And we also have built a service model that we think takes the hassle out of healthcare benefits for you and your employees and the administration. So this is a map, if you want to go to the next slide. This is a map of Texas, and it shows all of our regions. And as you can see, the names on there of our representatives, they're all with cities, just like you. So they understand your needs. Jeff Jordan with the city of Kaufman, which is not too far away, is your representative. So I just wanted to make a quick statement about TXHB. They delivered a 6-year average increase of about 6.1% for West Tawakoni. Now that includes the renewal credits that we will get into a little later. Many groups that leave the pool, they tell us that they wish they valued our stability over a 1-year savings. The question isn't what's cheapest this year, it's what's most predictable over the next 3 to 5 years. And that's the advantage of being in the pool. So when we went to underwriting and said that you all were considering a move on 4/1/2026, we asked them to provide a quote with new rates effective 4/1/2026. And so they were able to lower the rates 19% after reviewing the additional claims experience available. And that's an annual savings of $35,263. And then your new plan year would be April 1, 2026 through March 31, 2027. The next slide, please. You had a quote from ABA, so they had 3 plans that we were aware of. And I put this side-by-side comparison so you can just kind of see at a glance how we stack up versus rates versus benefits. The first 2 columns, Texas Health Benefits, this is your current plan at $1,500 deductible, $5,000 out of pocket. You can see the new rates there, $918.56 for an employee only. And then if you go on further down the list, you see the red font, and that is where I've highlighted the actual benefit differences in the 2 plans. So ABA does have a 2,000 individual deductible, 4,000 family. For this plan, we have the 1,500, 2,000, or 1,500, 3,000. And then the co-insurance under ABA is 30%. So that's what the member pays until they reach their out-of-pocket max. We do have the same out-of-pocket max of 5,000, but they have 30% co-insurance. We have 20%. Same office visit copay of $30, and then on the specialist, urgent care, and emergency room, their copays are slightly lower. And then the middle 2 columns is the 1,000, 3,000 plan that was quoted. So you can see that we're at $958.78 with the new rate decrease. And the only differences here in these 2 plans is the copay level. And so they do have some slightly lower copays there. And then the last column shows the $500 deductible, $3,000 out of pocket that we've quoted at $1,040.68. And then the ABA quote was $500 deductible, $2,500 out of pocket. And so you can see in red where I've highlighted the plan differences there. We also looked at some additional options. We looked at a $2,000 deductible with a $4,000 out of pocket. And so that rate came down to $916.68. And then the last two columns shows HMO plans. Those are kind of resurfacing as popular plans. They do bring some more savings, $880.22 for an individual or an employee only. In the 2000, 4000 would be $878.82. And of course, with HMO, it's physician directed. So you pick a primary care physician, and they will tell you which specialist you might need to go to. There is no out-of-network benefits, but they do funnel all of the care through one office, which does have some benefits. That provider knows everything about your health and can help tightly manage that. The copays are pretty much all the same. Now, I did not see the pharmacy section on the ABA quote. I'm not sure who they use, but we have our pharmacy benefits through Navitus, and the screen you're seeing shows the copays anywhere from 0 to 175, depending on the tier level, and it's the same plan on all of the quotes that we're providing. So I wanted to give you a little bit of input on the savings that we can bring to the member, and we do currently. We have the disease management program where employees, if they're on high cholesterol drugs, hypertension, or diabetes, they can actually save that copay if they enroll in the program. 0 copay instead of that $150 copay. We do use Lumicera as a specialty pharmacy, and also Navitus is the pharmacy benefit manager. So with our access guidance service, there's only over 450 drugs on the list. And I know the slide says 350, but that's been updated. And that's where, you know, if a claim comes in and it's for a certain drug and it's on the list, the member will get an outreach call from Navitus to ask them to join the access guidance service. And in doing so, they will have that $150 copay waived. So that's a huge benefit for your employees. So I'm going to talk about things to consider. I understand that ABA is offering a level funded plan. So there is some element of risk with those plans. But I do want to ask some questions. Are the rates quoted by ABA on a mature or an immature basis? And that's important to know, because if it's an immature basis, that can mean a pretty large increase at your first renewal, because you would be looking at making up those first year claims. So to the side, on the right side, I put together a chart which kind of explains how claim lag works. So let's say these are fictitious numbers, but just illustrative. Let's say you have $10,000 a month in claims on a mature level. You make a move April 1. What ABA sees is 0 claims in the first 30 days, because the claims that are incurred prior to April will still be paid by us. The claims incurred April 1 and after, there's a lag between the time the claim is incurred, the physician files it, it gets processed and paid. So you're looking at probably 60 days before, you know, the claims actually start ramping up. And so in this example, I've shown, you know, how Texas Health Benefit Pool will continue to pay claims. It's called run-out claims, because those are going to be claims that were incurred prior to 4/1. And so in this example, it could be as much as 22% of your annual claims expected level. And then ABA would have that no claim or very little claim in the first 3 or 4 months. And so they would be looking at paying out about 78% of the normal claim activity. So that's the first year effect. So if they have funded based on the 120,000 or the 93,500 in this example, makes a big difference to you when renewal time comes around, because it'll be short. So if you can maybe evaluate that from their quote, ask them questions, and make sure that it is a mature contract that you're being priced. Also, you might want to ask ADA if they're willing to provide a second year rate increase. Oftentimes, it's easy to get business in the door when, they're giving a really good rate, but then the time comes when everything has to be reevaluated. And so if you don't have that second year guarantee, you could be looking at significant increases. So also do the rates include a broker commission? I understand you're using a consultant, Renew, and so they may have included some consulting fees, and our plan does not include anything. The pharmacy, I don't know what pharmacy vendor they may be using for you, but anytime you make a change to a formulary, and every pharmacy company has their own formulary. That's where they look at the drugs and they say, we want this drug on our list. We don't want this one because it's too expensive. And so they're all going to vary by company. So Navitus has a formulary, and sometimes a formulary makes a change. They say, okay, we no longer want to have this drug on our list. We want to drop it. Well, that's when you hear the most noise, is when you take somebody's med away from them that they're used to and ask them to go to another prescription. So just something to consider. Whatever pharmacy they're using, there will be some disruption to the medications that your employees are taking. And so you'll just need to be prepared for that if you decide to make a move. Same with medical. You're using Blue Cross Blue Shield network. It's the largest network in Texas and nationally. UHC has a decent network, but there will be changes, some disruptions to your members. You may have some members that their position is with the Blue Cross network, but not in UHC. So just be aware of that. With ADA, members would have to start over on their deductible effective 4/1. And with our quote for a 4/1, your deductible would continue on as it is now until January 1st, and then it would reset. So if you have employees who have already satisfied their deductible for this year, then they're going to have to start over 4/1 if you move. Also, something to consider is that for the pool, we do have to have the medical in order to continue coverage for the dental and vision and the life insurance, as well as the pre-65 retiree benefits. If you do leave the pool, there's a two-year waiting period, and there's no guarantee that we'll bring you back into the pool after that period. Our underwriters will reevaluate you as a new group, and if everything looks good, they'll give you a quote. If not, it's not guaranteed. One other advantage with the pool is that you have one bill with us. So as a 4/1, if you were to move to ABA, if you have other products with different carriers, then you may have multiple bills to contend with. So these are just things I want you to think about when making your final decision on whether to leave the pool or not. Also, I wanted to point out some of the cost savings programs that you already have that are unique to the pool. There's zero out-of-pocket costs for using the Lantern. That's our surgery network. And I will go into that a little and more in depth in a minute. We have the telehealth medicine. Now we have MD Live right now. I know everybody has a telemedicine vendor with zero copay. So we have a new telemedicine provider we're bringing on board in 2026. And it's going to have some unique features. So I'll go over that in a minute. You also have the wellness program through Texas Health Benefits Pool. It's a $150 reward just for doing a few healthy activities. So your employees have not really been taking advantage of this program, but I would love the opportunity, if you should continue with us, to do more of a campaign to educate your employees on how they can take advantage of this. They can earn $150 every 12 months or every calendar year. And all of that is included at no extra cost. That's just baked into the rates with Texas Health Benefits. pool. So I mentioned Lantern. That's where the member can have a surgery for orthopedic, spine, bariatric, cardiac, or general surgery. If they qualify for one of these surgeries with Lantern, then all they have to do is call Lantern, find out if it's qualified. Then they get a dedicated coordinator who will see them through start to finish. And as I said, even if they haven't met their out of pocket, no cost. In your area, you probably have plenty of options for physician or for surgeons in drivable distance. But if you have to drive more than 100 miles, it does have a travel and lodging benefit to that. The other advantage to using Lantern is most surgeons have anywhere between a 5 and 14% surgery complication rate. Lantern has less than 1%. And that's because we've gone out and found, or Lantern has gone out and found very high quality surgeons. And for that, it's a limited network, and we're able to drive more patients to their facilities. And so that's how we are able to bring additional costs. And this is a savings to the city as well. And we'll go into that a little bit later. I mentioned the $150 wellness program. So all the employee has to do is a health risk assessment. It's an online assessment. It takes about 15 minutes. Just ask questions about your health and your goals, and then you do a biometric screening or an annual physical, and boom, you get the $150 check. If you have a covered spouse, which at the moment you don't have any covered, they would also be eligible for that $150. So total for the family, $300. If you don't want to have the biometric screening or the annual physical, then you can do a variety of online healthy activities to account for instead of the biometric to get the $150. Then I want to talk to you about pooling credits. The city did have some large claims, or at least one large claim this in 2025. So when the underwriters were rating your case, they tossed out all claim excess over $275,000. So you had at least one member with $275,000 plus claims. And so because you're part of the pool, we have a threshold, $275,000. Anything over that, we take out of your experience. It's not charged back to you. It's spread across all those 23,000 members. We don't charge for that. When you have other companies or your stop loss, you pay for having that pooling. With a stop loss, you have to actually pay a stop loss rate, and then they set the level. The lower the level, the more expensive the premium is. But the pool does this at no additional cost to you. And I don't think I said that $262,000 is what we pooled out and did not charge against your experience. So I mentioned that we have a couple of new programs coming on, and green imaging is one of them. Imaging costs can be very expensive. We probably all had one at some point in time. You have an MRI, CT scan, X-rays, ultrasounds, and many more. We are partnering with Green Imaging, and there will be a zero out-of-pocket cost to your employees when having these things done through Green Imaging. Now, we are adding this at some point in 2026, but then it would be eligible at your next renewal, which would then be in 2027. I also mentioned telehealth, that we have a new telehealth vendor coming on board in 2026. And with this one, as the current one, there's no out-of-pocket cost. But there is this added advantage of extended family coverage. So you can have up to 10 family members in your household use this, whether they're on your plan or not. It can be children, parents, spouses. So they don't have to be enrolled in Texas Health Benefits Pool, but they would have access to this CAP telehealth program. Just a rundown of some of the things I've talked about. just what it shows, the benefit to the member and the benefit to the city. Lantern, zero out of pocket for the member and lower claim costs for the city. Wellness incentive, $150 a check goes to the employee and or spouse. And then that keeps your employees healthier and hopefully saves in claims down the road. Schooling credit, we exclude all those high dollar claims from your experience. And then of course the telemedicine I just talked about. We also have Headway. Headway is a free mental health condition care. And we have noticed an uptick in many groups, even your own, of some mental health diagnoses. And so we're really focusing on that now. And you can book virtual visits or in-person visits through Headway. And they guarantee an appointment within 48 hours. Sometimes it's on your own. It's a lot longer than that before you can get in. With Headway, they also reduce your absenteeism and turnover rates. And then, of course, preventive care, early detection reduces costs. And then the two new programs I mentioned, the green imaging and telehealth. And again, all of those are unique to the pool and they're brought to you at no cost. It's baked into your rate. So should you stay with the pool, you know, there's a plan to try to engage your employees more. Utilization of the lantern surgery. I'm happy to come out and do employee education meetings. The wellness programs, get them engaged with that $150 reward. And then also maybe schedule a benefits fair or just a campaign, communication campaign on some of these programs. And then I wanted to just close with, this is your team. You have lots of resources at Texas Health Benefits School. In fact, we recently kind of reorganized how we do things. Myself and Desiree Beisel are your account management team. I travel a lot. I'm out face-to-face with employees and the groups. And so Desiree stays in the office and handles all the day-to-day stuff. We have Smorey Douglas, who is your EMB representative. That's eligibility and billing. So you have him as an additional resource. Tabitha Fogel, if you were to have any employees that need access to our online portal, she's your gal for training. And then Adrienne Milligan is our wellness expert, and she can coordinate any kind of campaign you might want to do to promote things to your employees. She also promotes the Circle Wellness on-site biometric screening. They do require 20 participants to do that, but what Adrienne does is she goes out to all the surrounding cities and tries to hub them together so that they can have a convenient location for all of your employees to go have this biometric screening done, and that helps satisfy that $150 reward. So with that, I've done a lot of talking. I'll take any questions if you have them.
Council, any questions?
I don't. I just have one.
Okay.
So had we not gone and shopped,
Mhm.
would you have brought us the 19% reduction in April?
No, we would have waited until your next renewal and review. Remember, you know, they just forgave 160 or 262,000 in large claims. So at the time when the underwriters were pricing, we actually gave you a rate pass, and that's because of that pooling. If we had not pooled that 262,000 out, the rate would have actually gone up quite a bit. But then we relook at the rates every 12 months, and then that's when you would probably receive something closer to your manual rates instead of where you landed. So,
Okay.
but it is typical when a group is looking for options that, you know, you would include the current carrier to also be able to bid the same information.
Sure.
You know, current information.
Sure.
I'm new to this group,
Okay.
and like the lantern and these new programs that you're offering, are they like local, or I mean, is it
Yeah,
easily
Lantern,
accessible?
they're nationwide, so they have surgeons in the Dallas-Fort Worth area. And I don't know of any, right here in this area, but, anytime an employee needs a surgery, they would just want to call the Lantern phone number, and they would tell them where the nearest surgeon and surgical facility is.
Any other questions, council?
No.
Thank you for bringing that, and
Okay,
going over it with us.
I appreciate your time. Thank you.
Quick interesting fact, my wife's name is Lorraine,
Oh, you're
spelled
kidding.
exactly like yours.
That is weird.
I looked at that and I go, she said Lorraine.
I've never met anybody that spells it exactly like I do. So.
Like she said, one other person she's met in her life, so.
Really? Okay. Well, maybe we'll meet past one day.
Yeah,
I'm gonna leave cards, my contact cards for all of you.
Thank you.
thank you.
And, thank you again for your time.
Mary, is he gonna be ready, or do you want to move around something?
As long as I can figure out how to get him to it.
Okay. Yeah, we're just gonna take just a second, guys. Working on some technical stuff over there.
So then I do a similar announcement like he did?
No? Sure.
Okay, since we're in kind of lull here. And JD's not here tonight, but, we had the water shutdown thing earlier. And I just wanted to say thanks to all those guys for their hard work getting it turned around really fast. Instead of 4 to 6 hours, it was just a couple hours. And it was great because I actually had a birthday party going on that day, and I was trying to figure out how people were going to use the bathroom. So we were going to go camp style and bring buckets in. But I just want to say thanks to those guys for getting it turned around so fast.
Sweet.
I'll have it extra night.
If they have questions, we'll walk around.
That's fine, that works.
Okay, all right, so we're ready to go.
Laptop.
Let me just talk.
Let me pull it up here real quick, and then, yep. All right, so number 8 would be discussion and or action on presentation from John Spencer for Azora regarding short-term rental software. Floor is yours.
Okay, so it's been kind of a comedy of errors. I'll start with a confession. I set up this great kind of tour of East Texas. I have meetings I was staying at my dad's house in Athens, and I got meetings in Tyler, and it was all worked great when I thought this was Thursday night. And Sunday night, sat down, looked at my schedule, and said, I can't believe what I just did. So now I get to work from Athens for 2 days, before going to Tyler and then to Houston. So anyway, and then I have this comedy of errors now with trying to connect via your guest network, which has some kind of security issue that's not working. Anyway, if we need to, I can show you walking around with the laptop. We can crowd around laptop. What we have discussed with you guys, is simply discovering and identifying every short-term rental on an ongoing basis within the city limits of West Tawakoni. And that will involve weekly scrapes. So every week, there's a sort of a polling that goes out, pick up any new listings that exist. It allows you to then trend, see what the growth is. It obviously allows you to see the address and GIS information associated with any given listing. It also provides for you, inevitably you'll send a letter to someone saying, look, you must have overlooked this, but you aren't licensed to be doing what you're doing. And they say, oh, no, you're all wrong. I'm not doing what you're saying I'm doing. And we have a dynamically generated report that will allow you to say, well, here's the kind of the dossier, if you will. It shows your listings. It shows, any all the evidence of why that was identified to that address, so that it's not a mistaken address. And inevitably, when someone sees that, they're like, "Oh, that must have been my wife, not me," right? Kind of thing. But they will begin to comply. I mean, certainly history dictates that they know you got them dead to rights. The cost of this is $1,500 a year. I can't speak to, the growth here. I have no history previously on what the the number of short-term rentals was, let's say, a year ago here or 2 years ago, so we start looking at trending. And I do not know what the growth expectations are here. Having just driven through Dallas, I have absolutely no idea why anyone would want to live there. I can't imagine you're not going to get hordes of people moving out this direction over time. You probably already have. As a kid, I duck hunted over Wills Point. And it doesn't look like it was when I was a kid, I can tell you that much. So I'm sure this area is growing as well, and I suspect you're going to continue to see growth in short-term rentals. I actually, last time I was here, I had, just for comparison, I looked at Gun Barrel City, and they've got like 300 short-term rentals in Gun Barrel City. Now, I couldn't believe that, but that's the numbers. And I pray that you guys don't ever face that, and I hope you get out in front of the problem and cap it before it ever gets to that level. Any questions, you want, and I'm happy to, who wanted to bring a laptop over and just don't have a mechanism to connect to the screen.
Council? I think we've gone through it pretty much already, and we know where we're at. Yeah.
I'm in favor of going.
Okay. I know that's where we had set this, was in favor of going, but just giving him a last minute chance if you had any questions. If not.
Is it a 1-year contract?
Excuse me?
1-year contract?
1-year contract renewable. And it may be that at the end of the year, you say, you know what, there's just not enough dynamic, regeneration of these things, and we now have everything identified, and there simply is no reason to
Are you constantly adding features to it, or is it?
well, there's an upgrade path, and that's, so I would say that kind of the hinging, that's the right word, the breakover point, is right at about 60 short-term rentals. Trying to do this manually becomes sort of unruly.
Yeah.
And that point, you probably want to start looking at upgrading, which provides licensing, it provides tax collection, it provides all that kind of stuff for you. And then this, of course, gets discounted back against that.
I think right now I found somewhere between 20 and 35. What I will tell you is I'm having to put in multiple dates and search it as if I'm looking for an Airbnb to rent. And I have to put in a different date, and then a different date, and then a different date.
Has to be available, has to be available for you
And
to,
that's,
Yeah.
So this will basically give you a list.
This is gonna give us a list where I'm not having to hunt this much or spend this much time trying to figure it out.
it's actually,
And then I gotta take pictures and say, oh, okay, this could be 1 of 3 houses. Most of the time, I can look at it and figure out which house it is. But there has been a couple that I've actually had to really hunt to figure out which house it was.
Well, if we don't have any other questions, I think we're
You
just
got the
about
software
ready.
pulled up?
I do.
Y'all want to see it?
Anybody
Yeah.
Anybody wants to come see
I
it?
know.
show it to Chad, I'm doing math.
Is this the best?
Shannon,
You guys, I always figured they should make
Give me
one of
a
these.
time frame
There's
per
a,
week.
there's a monitor on this side too,
on
so you can see
If
on
I was
either
doing this
side.
every week, it'd probably be
So
a
this
couple
is,
of
this
hours
is Collegedale,
2
Tennessee,
hours.
which is
at least.
kind of a
yeah.
similar
let's go 2 hours.
community. that
So
do
this is what it will look like.
This is what it will look like. Okay, so this is every identified
Yeah, by the time I
short-term
go
rental
through
in Collegedale.
each one of the sites, this
Okay.
is 3 that I found,
So we can
and then I
then
search
say,
different
okay,
dates,
up here,
and then different dates.
you can
and
export
different
that out
dates.
to Excel if
Check
you want
each one
to.
make
So
sure
just
it's
a
the same ones you
reporting
have.
tool,
The
you've
last
got
time I
that.
found 3 new ones,
That's
and then
nothing
I had a whole
that's-
bunch not
if you
showing
wanna
on it.
see what,
So I
if you
don't
want to add
say
columns
remove them
of different
or if it's
GIS
not
type
available.
elements, if you want
So
like
this is gonna,
lat long or something like that on it, you can
savings of
kind of customize that
so many
however you
times,
want.
you know?
I
Okay,
think so too.
we can drill into here, okay, and see, okay, here is this report that I'm
So
talking about.
Once
what
you
it
get
costs.
the
And I can
report,
do it for you if you want.
then you would
See
go
it.
to them with
160.
It's
the
gonna dynamically
paperwork
generate this report. It's
Report.
gonna show us
and the
all the
fees and all
information.
that.
You compile this into a report, so when the guy says, oh, no, you got it all wrong, you can hand this to them and they say, oh, yeah, maybe not.
Registered, it's been a challenge.
Yeah.
This is also gonna give us, I believe, let's do. You said it. I'm gonna ask. I'd like to know
Okay,
who and how.
so this is gonna show you
Hotel occupancy.
Here's the,
Where's the pool to make the complaints? Where's the pool? It says no complaints. Where's the pool from?
okay, that's gonna be in the whole, there's a complaint module in the upgrade version. So that if you guys have a code enforcement officer, you guys,
She's
She's right here.
she's at it. So, you know, it allows people to say, look, there's a party next door, there's a whatever, and for you guys to track those kind of complaints, so that you can then, you know, suspend
Oh, that way
licenses.
we keep track of how many complaints that are.
Precisely, and you can actually assign either major or minor and all that kind of stuff to it.
Chad, just for numbers, if she spends 2 hours a week on it, it's $4,200 a year for us.
Yeah.
Versus 1,500.
Other things to do.
Jim, I can't tell you, I'm happy to send you the
She can
report.
say $1,500. She can make $1,500 a year just doing.
So are they able
Ordinance
to
enforcement.
map out, like,
We're writing tickets.
basically
Yeah.
draw a square wherever the city is, those addresses, or how does it?
Yeah, like, so here is,
Okay.
and I can show you West Walker too, if you want to see what it
Yeah.
looks
I
like.
have a question. So with that GIS data, can we import that into our GIS maps?
You cannot go backwards into the GIS. We can bring GIS in, we do not write, and you do not want us writing your GIS.
Okay, that's why I was just curious if we
You're-
could add those.
Your GIS folks would not,
No problem
if
with
they were sitting right there, they would be, you know, objecting right now.
that.
They do not want us mucking around.
Gotcha.
So we bring, it's sort of a one-way street, we can bring it in.
Okay.
Now, it's easy for us to report on things where we find errors in the GIS,
Mhm.
and we can then sort of do a circle, but we will not do that update, we can hand it to them to do the update.
Okay. Okay, cool.
But you do not want to let
No,
Joe Cube into your GIS doing that.
Okay.
And
I don't,
here too, we can do things like, here's the evidence. This is what we have done to gather the there's something now with the network again.
It was, my phone was running really slow and I'm connected to it.
Yeah. Anyway, okay, so what the evidence tab would do for you is to say, okay, this is why we have identified this address as the correct address. You know, so if someone says, oh, no, you got it wrong, you have that. A parcel is going to give you all the GIS data associated with it. It's going to give you ownership information. It's going to give you all that associated with property. Listings is going to give you, here's the Airbnb link, here's the VRBO link, whatever it is, back to that property. And again, what that report does is compile all of this just into one central report. And then complaints, like I said, that's part of the bigger package. It would allow you to track. You know, and like I said, with less than 60, it just makes sense to do this manually. You know, to manage compliance. Once you get above 60, like I said, I mean, we deal with places that have thousands and thousands, and at that point, obviously, there's no other alternative. But at this size, I'd say 60 is kind of a breakover point. And you're probably at that point, you're probably looking at between 5,000 and 6,000 for the full kind of system. But I think at this point, it's way overkill.
Very good.
Yep.
One question for Mary before we proceed. If they move forward with this, we're set budget wise. No, nothing needs to be happen there.
I know Blue Star, and we've saved some other areas that we're good to go on that.
We should have some application fees
Yeah,
that
I
we've
was just
already
saying, plus the
collected.
application fees, we cover that.
Just wanted to validate it.
And you can actually use hot for this as well. Your occupancy tax under state law.
Did not think of that. So, yeah, we're good. Either way, we can
What was
read
it?
it.
You
Figure it
your
out.
dirty hands off my money.
Are you the promotions guy? I get
It's a hot,
that.
it's a hot topic.
I'm just, all I tell you is the law.
Appreciate that.
No, that is good to know.
By the way, another thing that I will tell you that, on the law, and we're seeing a lot in Texas right now, is classification of short-term rentals as commercial properties. That's another one that I know it can be controversial. It can be, but that's something we're seeing.
Is that how they're using it to keep it out of resident, to keep them out of it? Because a lot of cities are trying to eliminate it,
Totally,
right?
I can tell you, like in Fredericksburg, in the city of Fredericksburg, the average tax bill increases by almost $2,000
By making it a commercial
by making it
property.
a commercial property. So it's obviously a disincentive, but it also takes, just because of the hot restrictions, city suddenly says, hold on, we can now use this in our general fund. Because it's coming through property tax, not through hot. We can apply that in a place like Fredericksburg. The data is crazy. The emergency services and whatnot that short-term rentals are causing.
Sure.
I saw a statistic the other day. There are 80-something% of DWIs are non-residents.
So how do they deal with, so like the cities that are, if you had a residential district, you had a house,
Short-term rental.
short-term rental, a house. How do they make that a commercial property? They just carve it out and
The
just
assessment
change
district
it?
says you're a commercial property. It doesn't matter the zoning. You don't, it's not, I guess I can get the details for you how exactly they're doing it. I don't know if they consider it a special use permit that they're issuing.
Okay.
So if you have a sub, then suddenly.
Probably. There's a way around it. I was just curious how
Yeah.
they did it with the zoning laws.
Yeah,
So.
no, but I think it's the tax thing that they're primarily
Sure.
focused on, and it's a place like Fredericksburg, it's almost $6 million.
Yeah. Thanks for the info. That's,
Okay.
what do we need to do?
So it's up to us if we're ready to vote on it. It's under where you can,
I'll make a motion that we, do this $1,500 level, subscription.
I'll second that.
okay, I got a motion and a second on the table.
Chad Jacoby.
Ramsey Lindsay.
Greg Sprinkle.
Yep.
Cecilia Urban.
Motion passed. All right.
Right,
Did you set it?
Now, first you want to see the contract.
Yes. You give me the contract.
I will send that to Shannon and.
Either of us, I can forward it to her, so, yeah.
Okay.
And then we'll have it looked at and then we'll go from there.
Y'all could just redline it however you want. The lawyers had it to me.
And that's all we're gonna pass it there.
All righty, well, I'll be in touch and thank you.
Thank you, sir.
Thank
Thank
you.
you,
We
John.
traveled all this way so
Well,
early.
now I'm wanting to see my dad in Athens. My dad's thrilled with this whole concept.
I'm sure it is. Okay, we're gonna move on.
All right, thanks, guys.
Thank you.
Thank you.
Number 9, discussion and or action on current sign ordinance and possible modifications. Who's running that?
Shannon, what we've got is a sign ordinance that currently allows for large billboards. And I've had several citizens voice that we have a company going through town trying to purchase areas to place these large billboards on. So my concern is that we're going to end up with a lot of billboards in our city. We have to do something to prevent this. Because if our ordinance allows for it, I have to allow it. If our ordinance does not allow for it, then we don't have to.
Okay.
And so my thought process is that you might want to go over our sign ordinance and decide what you would like changed in it.
Can we see it?
Oh,
I just heard
I
another.
thought you got copies. I can go make copies real quick.
She's got one.
So you
Yeah.
got one? Do you know what you're talking about? Yeah. You want me to look at it?
I
Have
think
you looked at
we-
other things that need to be modified while we're doing this? Because I know it's under your project, or is there other?
That was the main one.
Okay.
I mean, my thought process was, I just don't want it to turn into Vegas going down our main avenue. And,
And we currently have one.
With two, right?
Well, we have one that went up in the past year
But is it?
at Rancheros.
Is it two double ones?
It's on each side.
There's one there and then there's another one.
But the other one's not in the city limits, is
It's
it?
not.
I
Yeah,
I
don't
think
think so.
so.
We have one that we permitted.
yeah, I thought I saw one down that direction.
So they're complaining about one.
They're more concerned about us having a bunch.
Yeah. So if it's in here, then they can have them. But if we take out that provision, then all those billboards are not gonna be allowed. like the one that we've been discussing is if it's your business, you have the right to advertise your business. But if it's somebody else wanting to come in and say, hey, can I put this billboard on your property? That's what we're concerned about.
So those would be off-premise signs, I believe. Off-premise signs are signs that advertise a business that is not located on the grounds that they are posted on.
They have them in Quinlan, they have them all over the place. Nobody really notices them. I have an issue with it.
So I see on-premise, number of on-premise signs,
Second
off-premise
page.
sign, 301 square feet, that's 10 by 30, right?
Yeah.
That's a pretty good size sign.
So it said this ordinance came through, what, 2018? And a lot of time has passed since then. You want to review it and see what your thoughts are. They've kind of given their thoughts on modifications.
What are your thoughts?
Your thoughts?
I think the number, if you want to prevent it, I think we need to not allow off-premise signs. Meaning signs that don't belong to the business.
Yeah, that makes sense. It's not, if that makes you a billboard, not a.
Correct.
It makes a lot of sense.
That makes perfect sense.
You just don't have it all over the interstate to display on.
But if you wanted to start, if you want to reduce the size of signs or anything like that that we do allow, now would also be the time to do that. So we modify it once, not 100 times.
Yeah, I mean, because if we have a business in there and I think 300 square feet's too big.
How big is the sign down there? Yeah.
I honestly don't remember.
300.
So do we need to
That's
counsel
what we
everybody get a
allow
copy of this
today,
ordinance
301 square feet.
and
That's 10
review
by
it?
30.
30 is just so huge.
Yeah.
They can contact me and say, hey, I'd like to change this, I'd like to change that. I can redo this and essentially have it ready by the next
The
council.
one I'm talking about down there, right there. You seen it?
Yes.
It's in the parking lot right there.
size of that wall.
It's
Yeah.
pretty good size.
That's big. I think we need to modify that.
That's the billboards.
Yeah, I mean, I think we need to modify the 10 by 30 to something smaller. I'm open to suggestions.
I think get rid of it completely because you're taking away other business rights to be able to advertise. Keep money out here.
Well, but who's making the money?
Right.
You know, city's not making any money on it. We got property tax on a commercial piece of property. That does have to be on a commercial piece of property. It's also in the downtown revitalization zone. Nobody's gonna put a billboard up on Rabbit Cove.
That's the vision on what's going down through there.
You just want me to, I'll say.
Can we get this back on the agenda for the March 9th? So we have time to talk about it and think about it?
We can.
Well, it's on the March 10th agenda.
Okay.
Okay,
I
well,
want it on the March 9th agenda because I want to come over and talk to myself.
okay, so
We can make that.
that can be your motion. I would ask that we get, well, if it's gonna be on the agenda, we get a copy of it out. Maybe if we could get a copy of it out to everybody earlier.
I can email it out tomorrow.
That'd be
we could
great.
do that.
That'd be great. I make a motion that we put this on the agenda. We table this until the March 10th agenda to discuss and take action at that time after we've had more information about size, since we're just debating not only whether or not to allow billboards, but to change the current sizes.
I second that.
Okay, I got a motion and a second. All in favor?
Let's go.
Ramsey Lidge, Greg Sprinkle.
James Shem.
Cecilia Irvin.
Motion pass. Okay, moving on from there. Number 10, legacy project progress. A, discussion or possible action on an update from Council Place 1.
I don't really have an update.
I've heard this, in case you needed it. This is not for commercial.
Where's the zip code? Yeah. The zip code, we're still trying to figure that out. I don't know if we're gonna be able to get a zip code because they're going small, but, and then the water, we're still trying to figure out what all we need, right?
Yeah.
Yep. That's all I got.
Okay, so no updates to speak of. Everything's still moving forward slowly there.
Yeah.
Okay. Moving on then, B, discussion and or possible action on updates from Council Place 2.
Maze Lane, I really don't have any updates there.
Let me throw one in there for you real quick. More than anything, just to remind the citizens to be careful going up and down through there. We've had community service and public works trying to still get all that cleaned up along with the tree company. So we're still working to get those trees cleaned, the ditches cleaned, and trash picked up.
Radio read meters is, we are waiting to see if we can get in on that grant. And that means that we are also subject to audits, which I'll get to in just a second. Staff insurance, I was a little surprised to get a presentation tonight when I thought we had already decided that we were moving on with that. And going to the with the plan.
ABA.
Yeah.
I thought we'd already made the decision as well.
So
Well, we did, but I think we gave Mary the okay to dig down in, research and all that. So of course, that's something that should be done.
Yeah.
I mean,
No,
it
but
doesn't
that's
change what we're doing. It just made sure we all was available. We all saw what we had there.
my concern is if we slip another month, it's another $6,000 that we're gonna in savings that we're not gonna capture. So I would really
We
like
still
to.
have time.
Did you see anything in their presentation that made you just go, oh, whoa, wait?
Well, I've always still been favor just sticking with it,
Okay.
in my honest opinion. But they do have some newer programs that I think would benefit the telehealth, especially those that can't necessarily afford all their families. Telehealth, you can add your extended family. The wellness credit they've always had. And I did like to see that they were able to re-rate it and look at taking some of those bigger claims off. Because I know we did have some pretty big claims last year. I mean, the rates are close, and there's definitely a few other options we can look at, just to make sure we're all making a truly informed decision on what we're going with.
Have you had any feedback from other city employees? One way or the other?
There's just a general concern of switch because everybody's nervous of change, but that's not out of the ordinary.
There's a concern about pricing on medication too.
Yes, there is a big concern on
Big
medication
concern,
prices.
yeah.
And because they don't know, because this new group, we don't know what their medication listings are. I know we have an employee that's worked really hard with Texas Health on getting their medications at a manageable.
Have we reached out to the new ones with these medications to validate?
I have not been able to sit down with that employee and them at the same time, get those kind of laid out on what their prices would be. But the reason is because the employee is working with these programs.
But can you get a list of what that employee's concerned about and then talk to that, insurance person?
Because they don't cover it really high.
I know council's already said that we're moving, so let's make sure we're moving in that right path. I'm all for getting the research and making sure before that last minute, but we don't
Yeah, we
want to
still
run
have
out of
time, to move forward with either or. We still get that 4/1 start date.
How much time?
We would still, no matter what, through the end of, if we were to exit the pool, we would still have to pay through the end of March.
So when do we have to tell them that we were exiting the pool?
By the end of February.
So
So
March,
by
that's
Friday.
next Monday.
Yes.
No.
Yeah, that's
Friday.
Yeah, that's Friday. So we don't have time.
Well, we were at a point with the other group that they were ready to roll. So, other than I need to make some final things with the dental and vision, and then we could exit and move forward. But I wanted you guys have all this in time so we can all make it. Which, I mean, there's still, even with the new rates, they are a little bit more expensive. But there's still some pros and cons and some risks to think of on this. In the packet you guys have is the actual proposal versus her presentation. So there are other rates. There's the HMO rate that she mentioned, which is not far off of what we were already looking at. She did say that's becoming a more popular plan, only because it's position driven.
HMO means you have to use their doctor.
Yeah.
So a lot of our
No,
doctors may
you-
not be covered.
So the way she explained it to me, you use your doctor, and then if you have a specialist, then you go through your physician, and then they send you that specialist.
It
If you're already
says-
with a specialist, then there's no change.
It says out of network, 100% is what you will pay.
Yeah.
If in an HMO, if you don't use their doctor, you pay 100% of anybody that is not in their network.
And then their network is still the UHC, which most doctors are covered under. So highly, they're Blue Cross, aren't they?
Blue Cross, UHC, and ACA.
That's ACA.
And what you pay in an HMO does not count towards your deductible.
Right, and so as I say, I just wanted to have all the options there. If the other one is still there, then that's what we go with. I mean, we're still gonna look at what's the best financial for everybody, but I want to make all the benefits are the same.
I can also tell you that some things that they've been concerned about is if they have group plans where they have their kids and stuff on there, is what happens when it goes up next year. And it's that high and they can't afford it. because
But we
it's
don't
more than
have
what
any.
were.
We don't have anybody that has group coverage.
But if we're gonna go to
We
the
have
other one
people
that
that cover
could,
their spouses.
everybody's spouses are covered.
The latest one.
No, we don't, none. That was,
I
yeah,
thought
that
she
was,
was now.
She was, but if we go with the new plan and people decide to, and then there's a jump, that can be a concern, but at the moment, nobody's covering it. And they're not going to sample.
well, but we also heard, that jump is across the board. I mean, it's gonna be from this company as well. Texas Health is gonna do the same thing. They're gonna jump as well. They came back in because their business is threatened, right? And, she made the statement that your deductible, that you started on January 1, is, you don't have to, if you've already met your deductible, well, it ends 1/1. That's the exact same thing as if you start on 4/1 and it ends on 4/1 next year. So, which is what I was like, that statement made no sense. Maybe it ends 1/1 on this new plan, and so you only have 8 months to fill your deductible instead of
Well,
12.
she's talking from, if you've used your deductible from November to now,
Mm-hmm.
if you've already met it, we'd already have to start it over, starting 4/1. Which
If
we
we
would
went
have to
with
start
the
over no
new
matter what.
Right, but the next year's starts again on January
Yeah,
1.
still 1/1/1.
Still, so it's a wash either way. They're both going to be the same. And I think we have some options to address that unique situation anyway.
Yes.
Yeah.
I don't really want to wait another week, and nothing in there told me that was
This was the better option.
that this was a better option. It's still more expensive. It's still 20% more.
Okay.
It's not 100% more, but it's still 20% more. Right. And,
And I can, if y'all have that same consensus, I can go ahead and.
there's
exit
5
and-
people here, so I gotta let them talk. So there's 5 people here. I gotta let them talk.
So the possibilities of a rate increase, I don't see a rate increase coming that would be big enough to offset the savings that we get from the ABA.
Well, plus the gentleman that spoke to us about this new plan said that they searched through other
Yeah.
avenues and see if they find something
Yeah,
better.
he's
Which
independent
means
agent,
change again, but
independent agent.
Saving with the other one.
I use an independent agent on my home and my other properties and things, and they shop every year. All as many companies as they can and come to me with the best deal. And that's what he'll do.
I do understand, if a employee has certain things going on with them, they're scared to change because of their, amount of money's out of pocket, or they can't get this drug or whatever. I mean, I can see that being a fear, but we already kind of discussed that before on how to handle that.
But we save 72,000, right? So that gives us some ways to, compensate if we have to.
Okay, so she's already got directive, unless there's any change and there's nothing to do there. I mean,
Right.
She's got till Friday. I want to ask one question, if there's anything we need to do with your office being messed up. it's not gonna end.
I'm not gonna completely be able, I mean, I'll be fine until Friday, so now y'all may not be able to, I may not respond to emails Friday afternoon, but I'll be fine.
What you gotta do with the new insurance, you're good to go. Okay, sorry.
Okay, and since, since a couple of my things are already wound up, I have been doing some things related to audit. And I had contacted, Brad Bryan with Canada and Canada, and that's the name that I'd given to Mary. And I just wanted to follow up with him to see exactly what it is that we needed to get, to find out how we do business with them, because they have the horsepower to get this done. I think we are though, we're looking right down the barrel of needing to get this done when all of America has a April 15th deadline. And so we're going to be competing against hundreds of millions of people for CPA time. And he gave me a list of items, and it's fairly long, so I didn't even bring it to recite here, but I forwarded that email to Mary. And I know that he's going to ask for things like trial balance, the latest audit that we have. And there are several other items. He said when we get that, he can give us a quote on what they would charge to do the audits. And at that point, we would sign a letter of engagement and begin moving with it. And I also want to discuss, let's go around and think about this, allocating some money for temporary help if we need, because there's going to be, to get through this many years, there's going to be a mountain of stuff that's going to have to be scanned and categorized and sorted and set aside. And I want to apply as much help to this thing as we can, because we have a one-time shot at a whole bunch of money to get the meters done. And I think really we have a deadline of May 1st. If we don't hit that, then our meters are out of the question probably. And it's going to affect anything else. So to me, that's the hottest button we've got.
So what you're recommending is hiring a part-time person to help, or do we need to get stuff to them to get a quote first?
So I think, yeah, twofold. One, let's get an idea of how long it's going to take us to get together the documents that he needs. And that's, there's a list of them. I wish I'd brought it now. I have it.
But you've already sent it to Mary.
Yeah, it's gonna be stuff like, give us all the 2022 bank statements. Give us all the 2022, water revenue. Give us 2022, budget, and it may all be in Quicket. And so, Mary's gonna be doing Mary's job, not going and sitting in front of the bank computer, downloading and printing and putting into a spreadsheet all of those bank statements and all that stuff that they're going to ask for. That their job is to put it all together into a usable format that they can then audit and say, okay, your numbers balance, or oh, this is a risk, or whatever it is they say. I've never seen a completed audit, so I don't know what they look like. I don't know what information they bring back.
But two thoughts here. One, the list is not that long. It's trial balance.
Very short.
Trial balance is one of the things. An income statement, a balance sheet, the general ledger, and the prior year's audited financials. So we need the latest audit that we have, and then we need these other 4 items.
Okay, wait a minute. So you were using Quicken or you weren't, but
We were, up
With
until
books?
24. Now we're using FundView.
but for what the year that they need, it was in QuickBooks?
Years.
The balance sheet,
Years.
I
income
mean,
statement.
it's all just put in a date and pull it up. I've used the program. I mean, it's
It
not
should-
hard to get.
This
And-
statement, this list, I can get done, tomorrow. I need to figure out what kind of income statement he's looking at, if that's not the same as our financial statement, our most recent one, I can get that. And then to add to the audit conversation, since we're there, and that's on yours, I do have a draft proposal of the audit, like the final 21-22 audit. He is still reviewing it. He had some time out, there was something going on, that he is working on trying to get it finalized and ready to show us, so that I can give him that.
Okay.
Draft.
Yeah, we're not, it's just, we've been talking about this since last January or February or March, somewhere that time frame. And I mean, I'm thrilled Ramsey's jumped in it because mostly because he's the smartest guy in any room I've ever in. So, but being able to take this to the steps where we, I would ask you what we're doing and what we're having. I don't know the right questions to ask you, right? But I know that this is something that's important to us getting to the next step. And we want to be able to get you the help. I would much rather you be working on the insurance and the, bringing on the city admin, doing all of the stuff that's really your job, rather than digging out an old QuickBooks from 2022. We can pay somebody to do that and be able to make that their all-day task, because you get 15 minutes here and 20 minutes here, and then there's 2 water leaks and, some in some other emergency, whatever, you say right now, I can do these 3 things tomorrow, until those 14 things that happen every day happen tomorrow. Right. And so we want to dedicate a resource to doing that so that you can go on with the operation of the city.
Yeah, and the things, if we have a temp doing that kind of thing, I'd much rather pay the temp whatever rate that is, $15, $18 an hour, something like that, as opposed to the CPA having to dig it out
Yes.
at $200 an hour.
And you're going to direct them, go get me this, and don't come back until you have it.
Yep.
And you know what I mean?
And go to the scanner. And,
yeah. You go in, there's a skeleton sitting in the chair because they can't find it or whatever, send them to the dusty files. That's what we would prefer you do.
Okay. So I'd make a recommendation. When it comes to you, I would recommend that we move it over on his, so that as he's handling it, it's under his where he can make motion and be able to continue pushing forward. We don't have to go back and forth.
Perfectly
So if
fine.
we're wanting to do something with it when we get in there, let's make a recommendation, a motion, and move on from there. Good with that?
That's all I got.
Okay.
I have one more question on that. That's
Okay.
okay.
Now,
Don't we?
we're gonna bring it back up here in just a minute.
Okay.
Okay, so we can move on from there to C, discussing possible action on updates from Council Place 3.
That would be me. So I'm going to jump right back into the audit process.
Yep.
Or audit progress, because we're still on the topic. Cecilia, you had a question?
I do, because I don't know everybody at the city as of now, but don't we have a financial assistant? Wouldn't that be something that person would
She
do?
works on that part of it, yes.
I mean, I don't understand why we need to hire a new person if we've got 2 people that would be working on it. I'm just asking the question. I don't
Well, the
know.
question would go back then is, what is her availability?
Yes,
How much is she?
Since she's been here, she's working on getting a lot of things caught up. She's actually closer to a point where she could be helping more on the audits. It's really, I feel, especially if we're gonna move to a different CPA, I wanna know what their expectation is, what they're looking for. Because going with the current CPA that we have, they're now, well, okay. Let me back up even further. So we got 2 CPAs. We got CPAs doing it, then we got the auditing CPA firm. So the one that's doing our cleanup, they have switched people. So now I have a different person doing it, same firm, and they're asking for a ton more documents than we've ever had to give prior to. And that's going to take a lot of time to even locate these things. These are really old documents that the firm once had, but that person's no longer there. So that's where we're at on that one. And then as far as the auditing firm, that firm, we're waiting on them to do that. So if we're switching, it's gonna be a matter of what are they gonna need? And then that can determine how much time we're gonna need to devote to finding it, locating it. I think it should be relatively easy. But I say that and then I'll be walking through every morning and something new happens.
Can you back that up? Just, so the CPA firm that is putting it all together to be audited switched people.
Correct.
The person that now has it doesn't have all the stuff that the person before them had.
Thank you.
Why are we working with them?
That's why I'm open to looking for other ones. And I just discovered that not too long ago when she gave me this list of all these things. I said, well, shouldn't y'all have that? Well, I don't have what they did before. So then I've gotten the proposal.
Guess what else she doesn't have? The business they had before.
Yeah.
That's ridiculous.
Great. That's why I'm talking with this, and then I got your proposal that you sent me. So I am all ears on that because that was very beyond frustrating because I thought we were gonna get on a roll. But
So think of it this way. You have a financial person here who is doing the everyday finances of the city. You have Mary who is doing the everyday operations of the city. Those things don't stop. But what we need is a dedicated resource to go get the items that whatever CPA we are looking for asks us to get. And Mary said, some of these may be difficult because they're very old files. Well, somebody's gonna have to go dig through the file box, through the file cabinet to find them. And if Mary's doing the everyday things she does every day, there's no time to go dig through the file cabinet. And so that's why, and the financial person is also not just doing the audit stuff. They are also doing, I'm gonna guess and say they're doing the water bills and
anything financial she's working through, we all do. We all wear many hats.
Well, and I will say, I think because we're so far behind
no question.
and we've got a date that we're trying to get to.
And none of us that were here at the times doing that. We're actually getting to the point where some were here, but not in a financial capacity. So we're looking for things that we've never seen, or we've never put our hands on, or we've never discussed.
And we're not involved. So in 2021, none of the people that work here worked here.
in a financial piece and part of it. Some did.
Some of
Nothing
us
was
started like the
organized in
end
the
of
first place, so.
2021.
I think if we can have a temporary person to do this,
I
mean,
do
it
ask,
saves a lot of
do
time.
a temporary person, can we do where it's like a contract hire, where it's somebody that's got experience in that background? So I'm
Gosh,
not
yes.
having to make sure
Absolutely. You pick them.
upfront.
Just make sure that the person you get knows how to do what you want done.
Yeah, 'cause
The
I
problem with that is you pay the temp agency has their fee on top of, but those temp agencies.
I make a motion that we go through a temp agency to get you the help you need and pass the audit progress stuff to Ramsey. With my assistance, I'm always available to help him and get whatever he needs or whatever you need to get it
now,
done.
do we want an amount? We need to talk budget as far as it comes to that.
What do you have in, so we have some open positions.
As far as sharing two things.
It's okay. You got
yes,
two
we have
years.
some.
So we
You
have
got one on each
some,
side of your head.
We have some in my salary because we don't have a part-time for me yet.
Okay, how much you got?
I don't know the answer to that. I just know there is some because we haven't hired them and we're in almost March.
I make a motion to up to whatever Shannon has in her.
Well, yeah, I mean, you got different budgets
Yeah.
because
We can
we're
always
going
bring
into
the budget
another
back.
month.
So-
City
so-
administrator, money's there.
What do you think? $5,000?
It's just.
They're gonna work for 2 months.
Yeah, I mean, we're gonna need them to get it all done, so whatever that's gonna look like.
I think $5,000 is a
$5,000
good
is
starting
enough.
point.
We can
Frankly,
always add to
to
it.
get these things done, I don't care how much it is.
I don't either, because it doesn't matter, because if we don't get this done, we can kiss goodbye any kind of an audit pass or grant pass
I mean,
in the future. And the amount that it will cost us just to maintain the stuff that the grants will fix correctly
yes.
will supersede that amount tenfold.
Yes, so with that motion, I've got this and I've got moving it to him. I'll have to bring the budget amendment back, of course, because we're gonna move and make it. So at that point, if I see that it needs to be more than that, I'll bring that to y'all.
Bring in March 10th.
Yes.
Okay, so on that line item, I have a motion on the table.
Second.
And the second, all in favor?
Let's go. Randy Lindsay.
Greg Sprinkle.
Jim Shem.
Cecilia Irvin.
Motion passed. You can keep going.
All right, park upgrades. So we have ordered and are waiting delivery time on the basketball goals. I'm going to call tomorrow on the basketball striping and paint. We have completed the installation of 9 cameras throughout the park and have lots of activity that we weren't aware of in the park. We are now aware of. So Paul Thompson, Kevin Jennings, both great job getting all that stuff done. I did purchase personally 9 or 10 signs that say video surveillance so that we will let people know that there are cameras watching everything that they do. We have them on both sides of the bathrooms. We have them coming in the gate, coming in the side gate, at the point, several around there. You can see lots of views. You can see lots of different angles. I believe that we did 4 360 cameras, which follow people as they go throughout, and 5 stationary cameras, and you can read license plates. So we know what's going on. We did have a gentleman with a baseball bat and an axe playing around there the other day. We also found a muffler and a steering wheel in the bathroom trash can. Random. But we do need to increase patrols in the park, and we need to increase an opportunity, some way to respond to those things that are going on in the middle of the night. I don't know what the right answer is yet, but I want to bring that up for discussion later so that everybody can kind of talk about what are better ways we can protect the park. On top of that, because we're going to have some new equipment, we want to make sure that the new equipment does really well. Also have completed my grant package and delivered it to EDC, asking for money for them to support replacing the pavilions. They had originally wanted to talk about replacing the roofs on 2 of the pavilions. We actually found money and a local contractor who is able to do all 4 pavilions for the same money.
Nice.
So we're going to get all 4 pavilions redone with the R-panel metal roofs. And I also want to bring up, if there's anybody that's out there that's watching, all 3 of the flags at the Veterans Memorial need to be replaced. I know that there might be budget for that, but we might also reach out to VFW, AMVETS, and American Legion. You know, it's 1 flag apiece. Be nice for them. And the next 2 things that came up, so those things are all in works. I'll go to the EDC meeting on March 3rd, and hopefully they will grant us the money that we're asking for that will allow us to do the roofs. We don't need that money to do we don't need any of their money to be able to do basketball goals, the basketball court, and the cameras. They're all already done. They're already budgeted. What I would like to do is kind of our target is to have April 1st as the date we have the basketball courts done. But May 9th is the Catfish Festival that the Chamber of Commerce is putting on. We're also a sponsor of that. I would like to see us find a way to replace the picnic tables and the grills. They're horrible. They're just horrible. We have 22 picnic tables throughout the park. We have 10 at the Veterans Memorial. Number one, we owe the Veterans Memorial better tables. But most of the ones, I think there's 6 or 7 under there that are still in pretty decent shape. We could move those into places on the park, but I would like to see us look at getting 3 grills. The grills that are there now are all leaning, they're torn up, they don't have grill grates. I believe that Mary said the grill grates at the Veterans Memorial are also rotten and they need to be replaced. I mean, it's just
Maintenance.
Typical maintenance, right? But we got to put money in the budget to do maintenance. And then I would like to see us do the expanded metal tables rather than the wood tables because they just don't last very long. And the 4 tables that are at the point, interestingly enough, the 4 tables that are at the point, I don't know how old they are. They're in the best shape. There's nobody back there watching them, but they are the metal tube tables with the 2x12 treated lumber wood tops. They're actually not too bad. They could be resanded and refinished, but they also could be replaced with expanded metal. If we had money for it, let's do it all at once. Let's make them all blue. Let's do the park right if we're going to do it. So getting an audit is going to be a big deal for us to get a larger grant that will allow us to do some other stuff, some larger projects. But I believe that is the Catfish Festival is going to bring a lot of people in. There's going to be a lot of people here. There's going to be bounce houses. There's going to be lots of rides. There's going to be lots of people here. It would really be nice for us to have some things that they recognize as improvements throughout the city and at the park. And those are the things that are pretty visible. And it does another thing. There's no place to sit. And you're going to a festival and there's no place to sit. So let's give them some stuff to sit on. I do think we probably ought to figure out a way to make most of the picnic tables stationary out there because they're all bunched up in one little place. And then there's about 4 or 5 that are by the RV pads. I think it might be a good idea to look at maybe in the future putting in picnic tables at the RV pads that are on the posts, that are pedestal, right? So that's something to do. But I'm getting pricing tomorrow on tables and grills. The grills are not going to be bad. They're going to be less than $1,200 each. So I think we can probably do those with money I might have left over in my current expenses, but I can't do it until after everything's been paid for. And I know the actual numbers, but I don't believe the tables are going to be that cheap. I don't know yet, but I don't know how many of them we can do, but I think maybe we can put a pretty good foot forward and do some.
Pricing on them and get that back to us.
Do pricing on it, get it back to you, and then we'll look at what there is in the hot tax and what's left in that, and if there's anything in the budget, and then if there's anybody that we might be able to hit up for some donations to buy a table and put a plaque on. So we'll start working that angle as well.
See what sponsors get to-
Be a great idea to be able to do it and say, hey, this table cost,
With, sponsors.
Thank you.
so we'll find a way to do that. That's my update. The new elementary school is no movement.
Okay, so we'll move on from there. D, discussion and possible action on updating from Council Place 4.
Connecting 276 to Rabbit Cove, you're going to reach
I
out.
do not have a quote yet. She's got it on her list to get. I don't have a quote yet.
Maybe next time, right? Hopefully.
Do what?
Are we going to get one? Correct?
She's got on her list to get us a quote to do the study for it, but I just don't have it yet.
Okay.
She's got a long list of things for us going on
What's the study?
to see what options we have to connect.
Uh,
I've kind of given her a general idea of kind of where we're looking, but she's gonna get with the engineering team and see what a study would cost.
Street lights throughout the entire city. Spoke with the guy who is the engineer. He came and rode around, looked at things. He said he's got 30 projects. So he's said by the next meeting on the 10th of March, he said most of it will be done, but he's not sure it will be complete.
Most of the project, like.
Most of the project pricing
Okay,
Oh.
will be done.
I want to make sure that something to keep in consideration. FEC does a lot of grants. I mean, a lot. So it might be if this is $1,000 that we could turn around and submit a grant to get that right back. So
We'll do that.
keep that in mind.
In City Hall, I think
We're still waiting on a meeting. Okay.
That's it.
That's it. All right, we'll move on from there. E, discussion of possible actions on update from Council Place 5.
Alrighty, on the community outreach, I need to edge in a time to meet with Mary, and it just hasn't been convenient. There's been a lot going on. I have started receiving calls from citizens, so I guess the word's getting out, and they're excited about it. They're giving me different ideas of what they'd like to see, and so we'll just move forward with that and try to get. I mean, what I think to present to you guys would be like, this is kind of the layout and the kind of information that we're thinking about putting in there. And I would like to have that for the next meeting.
Can I add something to yours?
Okay.
So today, my understanding is the only way to get the IRIS text messages or phone calls is to come to City Hall and fill out a form.
There's a form.
Is there an electronic option to be able to sign up for that?
I mean, the form can easily be emailed, and a lot of times we take the phone call.
Emailed or mailed, or, I mean,
Is there a
so,
link that we could put on the website
Yeah.
that somebody could go on and fill it out?
And I want to think there might be, or maybe an old link, it's not there anymore. Okay.
yes, the reason I'm saying this, because there are people that complain about not being able to, didn't get the boil of water notice, didn't get whatever, and it's like, we put it out, we need to put it out, the best way to get that communication is from Iris, right?
If we can put it on the website, then can we put it on Facebook and promote it through Facebook?
Yeah, so number one, how do you do it?
Link just for that specific form, because it is in the water packet, that's
It is in the
online.
online water service.
But I'll do it.
Yeah, I was told the only way to get signed up for Iris was to come to City Hall. And I'm like, okay, so I don't know how to do it, so I'm gonna go look for it. And I couldn't find it because I'm not signed up for water. I have water. Right, so let's put it in a spot and let's put where we put it really visible, like a giant sign. Can we get a billboard? Let's get a billboard.
I'll premise.
I got an idea. Yeah, 10 by 30 right out there.
But if you put it on the website,
I'll put it on the website, and I'll put it on Facebook. And I'll
There you
put it
go.
on the Facebook page, just so those.
then everybody just gets.
And then, what, they can just sign up for it and that will go to a certain place. We know where that form goes when they send it in? Do
Well,
they have
it's
to,
a paper form, but I will make
they have to
it full.
print it and mail it, or can they fill it out and have it go to an email that somebody will open and then sign them up?
A fillable PDF.
Yeah, fillable PDF, fillable Word document, something other than drive to City Hall, make sure somebody's here, make sure somebody has the form, make sure that they fill it out and it gets handed and somebody else enters it. I can't believe there's not an electronic way to sign up for an electronic notice.
Do we need to do this through a motion, or is this something that we can get taken care of?
That was what I didn't mean to steal your thunder, but that needs to be on your outreach thing. We got to be able to tell people better how to do
And
stuff.
Tammy said anybody can always call her and sign up for it. She just texted me.
Did
She
she?
must be watching.
Good. Hi, Tammy. Thank you. So put your number on the billboard then.
Yeah.
Anything else? All right, thank you guys. All right, we'll move on from there. 11, citizens input, 3 minutes, non-agenda related. Nothing?
Well, we don't have any more citizens that come in regularly without.
Okay, we can move on from there.
I'll make a motion, we adjourn.
Got a motion?
Second that.
Got a second. All in favor?
Dave, sir.
Greg Sprinkle.
Cecilia Irvin.
We're adjourned at 8:04.
I feel like if I make the motion, I shouldn't have to vote.
Hey, Mary.
Just 1 second, let me turn off the meeting and then I can. Oh, sorry.
Permission to speak freely?